practices at OptiSmile, which is a leading dental practice in cosmetic dentistry in South Africa. Welcome, Elna, and thank you so much for joining us today.
Thank you very much, Tanisha, and thank you for the opportunity to SADA. And yeah, dental whitening, I think, is a very important topic to touch because we're living in an era where everybody wants, the white Hollywood teeth. So I just want to maybe touch on a few things today and just give the public some basic information on what to look for and how to go about it. So I'm going to start off by saying what are the questions that is normally asked by the patient. So, the first question everybody says, but does it damage my teeth? And will my teeth be really sensitive afterwards? The one, of course, that they always ask is, does it last forever? If I bleach once, will it last forever? And what is the cost of the treatment? So those are the four basic questions that you always get when you discuss whitening with a patient. So the picture that you see there is our beautiful enamel under a microscope. And I always marvel at the design, that we take it so for granted that our teeth are just strong, but we have to make sure that we see the correct people regarding this, because it's very important for us to look after our teeth in a holistic manner in the body. So what is dental whitening? It's the removal of both the extrinsic, which is your surface stains that comes from smoking and drinking red wine and coffee. And then you get, of course, the intrinsic stains, which is inside the tooth structure. And those are the more difficult ones to remove for us. So your extrinsic stains is very easy to remove. You can go and see a dental professional. They can do guided biofilm therapy for you. They could polish the stains off, the surface stains, and then, of course, a complete plaque removal with removal of hard and soft deposits on the tooth structure, so that you obtain healthy teeth and gums before you embark on any whitening procedure. And people are very quick to buy over-the-counter whitening, toothpaste or strips or whatever. And I will discuss that later on, but you have to go to the oral hygienist or to your dentist first to ascertain whether your teeth are actually healthy to start this process. Okay. So your intrinsic staining, which is inside the tooth, is removed with hydrogen or carbamide peroxide in the process of oxidizing the stains out of those little tubules that you saw on the photograph. So this is, again, a microscopic view of the structure of the enamel. And so it's millions of little tubes that fill up with the chromogenic substances, which comes from tea. And so it's all the color that's in food and in drinks that we drink every single day. So it's your tea, your coffee, your food pigmentation. A lot of people drink excessive vegetable juices, turmeric. All the things that have high color will contribute to the staining of your teeth on the inside. So, and you must remember, your permanent teeth come out when you're about 6 years old, your anterior teeth. So if you get to 60, they've been there for 54 years, and they've had color on them for a very long time. So people expect, you to wave a magic wand to make them white in 10 minutes, and it doesn't always work that way. So it's something that you have to discuss with your professionals. So what are the different techniques that's available in the market? Your in-chair dental whitening is, of course, at the dental or the hygiene office, and that's your most effective treatment with a 35 to a 40% hydrogen peroxide. You cannot apply that percentage of peroxide on your own teeth at home, because you will definitely cause damage to your gum tissue. It will give you a burning of the gums. So this is not advised anywhere else besides in the dental office. This would be the most costly, of course. You're looking at probably 4,500 to 9,000, depending on the inclusions. So some people will quote you 9,000 Rand, but it will be for the for the cleaning before the time, it will be for your home trays and then your in chair. So always go into a discussion what you need, what you would like, and then, you know, get a quote first. Always get a quote first from your dental professionals. So the second mode of bleaching is, of course, with bleach trays. That is done by a professional only. So they would take impressions of your teeth after a full examination and repair. You cannot do bleach trays or take impressions if you haven't had your dental repairs done. So your mouth should be in a pristine condition, and then you take the impressions. Otherwise, if you still have dental treatment after the impressions were done, of course, they're not going to fit so well. So one would first do everything that's needed by your dentist and your hygienist, and then go into impressions of the teeth. They obviously custom fit for your teeth, and that's what makes it, you know, easy and effective to use. It's not something that flops around your mouth. So a whitening gel is applied that you get from your dental office, depending on the time that you want to spend. So you can start with a half an hour to 1.5 hours to 2 hours to 4 hours to overnight. So as the percentage decreases, so a 10% carbamide would be an overnight bleach, because it's a slow release and it's a carbamide peroxide. So if you want half an hour bleach at home, then you should go for a 6% hydrogen peroxide. So the higher the percentage, so hydrogen peroxide times 3, carbamide then gives you, if you're saying you've got a 10% carbamide peroxide, that would equate to about a 3% of a hydrogen peroxide. So always, whatever suits your lifestyle, you discuss it with your dental professional, and then you make a choice or a selection on the product that you need. These bleach trays are, of course, reusable for the future. So one would always ask the client, especially after you've had a prophylaxis, you know, they can say, okay, let's top up a little bit with my home trays after the cleaning. So that can be done every 6 months, every year, depending on a need-to-do basis. So always make sure that you store it properly, because so often people put it into a little tissue, and then the tissue gets chucked in the dustbin and they lose their bleach trays, or the dog gets hold of it. So store it properly in their little box. You will get a container from your dental office, and they will, of course, you know, give it to you so that you can store it properly. So the different strengths, as I explained, you must follow instructions that's given to you by your dentist or your hygienist. And the cost for this is sort of medium range, anything from 3,500 and perhaps up. Sorry. So then your over-the-counter whitening strips and home care products, there is a range of products available everywhere. Once again, I would not advise that you just buy things over the counter without consulting somebody, because some of the toothpaste on the market have a very high abrasive content, and you can brush your teeth with it. It will remove some of the stains on the surfaces of the teeth, but it will cause sensitivity at the same time, because you will be removing some of the enamel. So you have to be very careful to not use anything that's highly abrasive. So toothpaste have an abrasive index, and one needs to find out which one you are using. So there's strips available, little bleaching strips. You're looking at applying it for about half an hour a day. Very easy to use. Once again, follow instruction. And they have a, you know, it's a low percentage, but it does give you a nice lift. So if a patient doesn't really have very dark teeth, it's just a nice option to use. So your whitening toothpaste is really to maintain your whitening that was done by the professional and by the, you know, the home bleach trays that you have. So the toothpaste, I would also advise you to get a recommendation from your dentist or your hygienist. Then you get whitening mouthwashes. It's not really going to give you a major difference, but it will be part of them maintaining the level of whiteness. And then, of course, whitening pens. So there's many of these products on the market, and I do want to caution patients not to just randomly buy them without proper consultation. So then there's, of course, the question about, will my teeth be sensitive? The sensitivity issue can be experienced definitely with bleaching. And I always advise patients that they perhaps start maybe before they start on a bleaching program with a desensitizing toothpaste, just to help them to prep the tooth structure. But there are, of course, lasers. If you do bleaching in a chair, you can use a laser that will help to assist to reduce the sensitivity. And also, toothpaste that will assist the patient after the bleaching with reducing their sensitivity. And, number 3 here is, don't use abrasive home care products. And that would be my definite no in any product that you use. It shouldn't be abrasive. How long does it last? Of course, I always say to a patient, how long is a string? Because it's completely lifestyle dependent. So if you're drinking 5 espressos a day and you drink red wine at night, your bleaching will not last as long as somebody who drinks maybe 1 coffee a day and doesn't do red wine. So it also depends on the patient's enamel structure. Everybody's enamel is different, and one would limit what you take in on the tooth structures as to avoid the staining. So having said that, if you're using nice maintenance products, life goes on. We need to enjoy life. So but it's the excess of the foods that have color that will bring your color back to the teeth. There was a study done, and they did some bleaching on patients, and they found that after 10 years, the patient had a bleach and never bleached again. But after 10 years, they tested the patients, and they didn't have the fall back to the original shade that they were in. So if you think about you bleaching your teeth when you're 60 years old, you don't have another 54 years, hopefully, to build up the same staining again. So yeah, it's always moderation in terms of one's lifestyle. What is the take-home message for bleaching? Is always follow the instructions that is given to you by healthcare professionals, definitely by your oral hygienist and your dentist. The next point I cannot stress enough: do not go to clinics or spas that is not registered by the Health Professional Council for whitening procedures. There's a lot of pop-up shops everywhere advertising whitening, and they are not trained to recognize dental disease, dental decay, gum disease. And you often find that they go because it sounds cheaper, and then they end up having problems with their teeth. So the health of your teeth is the first thing that you should worry about before you embark on a bleaching process. So the natural shade that matches your skin color and the white of your eyes is what you should aim for, not Hollywood Snow White teeth. It must always be appropriate to your particular skin color and your eyes. 12 o'clock daylight is, of course, the best time to choose the shade of your teeth, or check the shade of your teeth, because then there's no shadow. So I want to end my slide presentation with all these beautiful smiles. And, it doesn't matter what age you are. It doesn't matter where you live in the world or who you are. A beautiful white smile, healthy smile, is always what we aim for in the process of whitening your teeth. Thank you, Tanisha.
Thank you so much, Elna. That was really such a condensed and informative session, and I'm definitely hopeful that it will be as beneficial to all of the members as the public as it was for me now, even listening to it. Perhaps you could maybe just touch on, if, for example, a member of the public decides to go to an oral health professional and has an in-chair whitening treatment done, then what are some of the behaviors or the things to avoid to help make it last just that little bit longer?
Okay, so for the first, after they've had a bleach, for the first definitely 8 hours, 6 to 8, even 24 if they can, do not eat or drink anything that will stain a white shirt. So my patient tells me, does chocolate stain a white shirt? I said, yes, of course it does.
Yes.
Yeah. So anything that stains a white shirt for that first 24 hours is crucial that you don't eat or drink that. So
Okay.
I always tease, I say, tonight it's rice, it's potatoes, it's chicken, it's everything
And
that's low in
water.
sugar.
Yes.
Water, no red wine. And
Yeah.
yeah, and you can have a salad, but don't have tomato puree. Don't
Yeah.
don't don't eat tomato sauce on your chips that night, so it's
Yes. Yes.
that sort of thing. Yeah. And of course, then the sensitivity issue. If there is sensitivity, you would definitely assist your patient in giving them um, a product or advise a product that will help them with the sensitivity. So you normally find that after about 24 hours, if there is a slight sensitivity, it will dissipate.
Mm-hmm.
The body the saliva has a natural capacity to eradicate the sensitivity by putting on little potassium plugs into those little tubules that you saw on the pictures.
Yeah.
So for us, it's really the first 24 hours is what you should avoid, things that can put the stains back in. After
Yes.
that, it's just the maintenance. It's good oral hygiene, good care for your teeth with good products, and it's always very specifically for you. That's tailor made. It's not going into a one size fit all shop where they
Mm-hmm.
do the same thing to everybody.
Yeah.
So people have different needs and different tastes, and you as the professional have to use your um, uh, discretion on what the
Mm.
patient will need. So yeah,
Yeah.
and then of course it's the lifestyle I spoke about. Minimize your coffee intake, your tea intake. Tea actually stains more than coffee. Think if I see in my
Oh,
practice,
wow.
it contains tannins, and the tannins is
Yes.
what stains. Yeah. So people say, I don't drink much coffee. I just have 5 cups of tea a day. So culprit. Yeah.
Does it matter whether you're having black coffee or you're having milk coffee? Does that make a difference?
Um, Look, the espressos do actually stain a lot, but um, I drink a coffee a day with milk, and my teeth also stain. So it does stain.
Yes,
It
it
doesn't
doesn't
matter
matter
what.
really.
Yeah, yeah,
Yeah.
yeah. So,
Okay.
it's I cannot stress enough that the patient has to go first for a good checkup, because
Yes.
I had a case this week where a patient came in and she wanted a bleach, and I noticed one of the teeth was just slightly yellower than the others. And on taking an X-ray, I noticed, well, we saw on the X-ray that that internal nerve was completely calcified and not even there. So now,
Oh,
if you
wow.
embark on bleaching because you think that the tooth is just yellower,
Mm,
you're looking at trouble down the line. So
yeah.
that's why your consultation and the preparation for the bleach is utmost important.
No, absolutely. I hope, if anything, that is the most important take-home message here for anyone considering teeth whitening is always have a checkup with your oral hygienist or your dentist. Make sure everything is in order and then go with their recommendations. I just want to see, I know we have some people listening. If there are any questions? Doesn't seem to be. Okay, perfect. Elna, thank you so much for sharing your knowledge and your expertise. It was lovely having you, and have a great day further.
Thank you very much for having me. I enjoyed it. It was good fun. Thank you.
Okay, thank you.